over to our first presenter this morning, Miss Amanda Martinez. Now, Amanda is a training program manager here at Mental Health America of Hawaii, and she's going to give an overview on the most recent mental health statistics in Hawaii. After her presentation, we're going to have a Q&A session with her, so please throw your questions in the Zoom chat, and we'll make sure to present that to her, and she can share her knowledge and her answers to some of the questions that you may have. But here to present to us this morning is none other than Miss Amanda Martinez.
Good morning, everyone. Thank you for that introduction, Nolan. I'm very humbled to follow Dr. Meyer, even though we only were able to hear a part of her intention setting. Today, this morning, I want to start off by giving you all just a little bit of a snapshot of the landscape that the past year has shaped and really continues to shape on mental health. So it's going to be very much a summary and a brief overview. And if you have any other questions or looking for more information that I am unable to answer in the Q&A with this segment here, please feel free to reach out to me. Even after today, I'm always happy to help point people in the right direction when it comes to looking for data or statistics. So let's start by taking a look at how COVID-19 has had an impact on mental health. So nationwide, we have seen really an overall increase of anxiety and depression really across the board. We've also seen for those individuals who were already experiencing mental health problems and challenges, an increase in severity of their symptoms as well. So everyone's baselines have kind of risen over the past year. And I would like to point out that research is still being conducted and constantly being made available. So this landscape is continuously changing as that new data and new research does become available. Well, hopefully with the next couple of slides, we'll provide everyone with a really general idea of the type of impact that we have been seeing thus far. And while we want to be looking forward, it's also important that we take a look back at some data that was pre-pandemic just to get a better idea of that baseline and what kind of an impact that we have started to see. So some of the statistics that you'll be seeing are prior to 2020 and can serve as that kind of baseline. And then other statistics will be during 2020 to serve as that little bit of a temperature check to give us a better idea. So with that, what we have seen, so these next couple of slides do reflect pre-pandemic data. We pull from a multitude of different sources. The main sources we have for today are Mental Health America as a national organization has a state of mental health in America report that they release every single year. We have some data from the Department of Health, as well as the Youth Risk Behavior Survey. So the next couple slides come from the Mental Health America National Organization, and this reflects research and data collected up to the year of 2018, but we've seen almost 18% of adults in Hawaii experience any diagnosable mental illness. We saw about 7% reported experiencing a substance use disorder, almost 5% experienced suicidal ideation or suicidal thoughts. Now, of that first 18% of adults who experience any mental illness, we also found that, or see that almost 66% did not receive any treatment, and 12% of those individuals reported not being able to receive the treatment that they felt that they needed and they thought that they needed. And we see kind of similar numbers reflected for our youth as well, right? Almost 14% experienced at least one major depressive episode in the past year at the time where the survey was done or the data was collected. About 4% reported experiencing a substance use disorder, but of that almost 13%, 56% did not receive any treatment or any help for that major depressive episode. And these statistics are pretty reflective, I think, of the kind of help-seeking type of behaviors that we see in our society today, as well as highlights the different types of barriers that are in place that unfortunately make it hard for individuals to access mental health services. So just as an example, here are some of the different barriers that are in place, right? It could have to do with income or finances. It could be a loss of a job, right? A change in financial income, or it could be a lack of insurance, right? Insurance coverage or loss of insurance because of that loss of a job. It could be because we often see an undersized mental health workforce here in Hawaii, but especially so on our neighbor islands. There's a disconnect between primary care systems and behavioral health care systems. I think that there is starting to be a shift towards treating the overall person as a whole. So treating both behavioral and mental health alongside with physical health, which is hopeful and encouraging to hear. But historically, there has been a disconnect there. And then stigma, that's unfortunately still associated with mental health, are just a couple of the examples of the different types of barriers that are in place that just make it harder for people to be healthy. So the more awareness that we can raise, the more we can create safe spaces for discussions about mental health to happen, and the more messages that we can send that, you know, it's okay to not be okay sometimes, but getting help is effective. And there are a lot of different ways to be able to reach out and seek that extra help and support. Then we can continue to really break down some of these barriers that and overall just increase access to mental health services. When it comes to workforce availability, Hawaii ranks 24th for mental health workforce availability. So while we have seen an improvement in the rate of mental health providers over the past couple of years, the need for mental health services will continue to increase, especially as we see increasing rates of anxiety, of depression, and other mental health concerns in response to everything that has been happening in our world today over the past year. So while we are seeing some improvements, we need to be continuing along that path and increasing those rates of mental health providers that are available so we can also increase access to services. Right, so when it comes to suicidality here in Hawaii, we often get the question in our presentations that we give is, will the pandemic result in more suicides? And according to experts and according to research that has been made available thus far, it is really unclear how or even if the pandemic will affect suicide rates across the country, or more specifically here in Hawaii. But what is clear is the need for immediate prevention efforts to be happening, especially amongst those who may be at risk. So here's a snapshot of some of the data that we have as a courtesy of the Hawaii State Department of Health and their EMS and Injury Prevention and Control System branch. Is that every other day here in Hawaii, someone dies by suicide. It is the second overall leading cause of fatal injuries, and it's actually number one for a cause of fatal injuries for ages 15 to 29, as well as 30 to 44. And Hawaii ranks about 14th lowest rates for suicide in the United States. So again, just a snapshot. This is all pre-pandemic data, highlighting the importance of those prevention efforts. So, stressing the impact that self-care can have, of identifying different coping skills that are going to work for you in different situations, right? Stressing mental wellness and the things that we can do more upstream before it moves more towards downstream, where someone may be in a crisis, right? Or having suicidal thoughts. So prevention efforts do work, and they are effective across the board, across different age groups, across different socioeconomic statuses. This data comes from the Youth Risk Behavior Survey. So this is a survey that goes out to schools every couple of years. So anonymously self-reported data from students themselves. So we see that suicidal thoughts can be common here in Hawaii, but fortunately, we also see these numbers kind of decrease as we move along the spectrum. And I realize I didn't actually label these boxes for you, so my apologies for that. That first box reflects suicidal ideation, so having thoughts. 1 out of 4 middle school students, 1 out of 6 high school students reported having suicidal thoughts. The second box in the middle, 1 out of 6 middle school students, 1 out of 7 high school students reported having made a plan. And then that third smaller box, 1 out of 8 middle school students, 1 out of 10 high school students reported having made a previous attempt before. So, when we look at data like this, especially when it comes to suicidality, the real takeaway that I want you all to have while looking at these past 2 slides is, not everyone who thinks about suicide, not everyone who makes a plan, and not even everyone who makes an attempt actually dies by suicide. So what that tells us is that there are a lot of opportunities for us to step in and help, right? For that prevention effort to happen, or those early intervention efforts to happen. And there are a lot of really great prevention efforts that are happening across the state of Hawaii towards suicide prevention. So if that's something that you want to become more involved in or want to learn more about, please feel free to reach out to us at Mental Health America of Hawaii. We can connect you to the right people, the right task forces that are happening statewide or within a more specific county. And here is some data that we can see as that temperature check, right? So these are results from Mental Health America as a national organization. They have a free online screening tool, which can be accessed via our website that you can see here on the screen. So this gives us kind of a visualization of those increasing rates of anxiety and depression over the past year. These are pulled from our youth or their youth tests, right? There are several different tests that you are able to take, but more specifically, this reflects those rates of anxiety and depression for our youth. And this is nationwide as well. So we see that kind of increase that's happening, right, over the past year. And I think what's really interesting is that it wasn't just the pandemic, right, that is the reason behind these increasing rates. We also saw them, stating those reasons as being current events, like the political divide of our country today, the social and racial unrest and discrimination that has been happening for a long time, but we've seen a lot more light being shown on it in recent months. It's financial problems, it's increasing feelings of loneliness and isolation because we're all practicing physical distancing, right? So there's a multitude of different reasons that are behind these increasing rates of anxiety and depression. So we can't just say it's just the pandemic and leave it at that. We have a lot of different areas that we can address. And I do want to note that even though we talk a lot about identifying risk factors and areas that we want to be looking out for to make a difference, right, and to step in and help, we also should be thinking about the different types of protective factors, right, that are present in people's lives. There are a multitude of those as well that help to increase people's sense of resiliency, which is super important, right? The more we can increase our own emotional strength and increase our sense of resiliency, it's going to help us combat all of these risk factors. It's going to help us move through tough life situations and take on the things that life throws at us, which does seem to be a lot these days. So just know that there are a lot of different local and national resources that are out there that are available 24/7, like the ones you see on here. These are just a couple of different examples. If you are looking for any kind of help or resources or information about mental health services that are being offered here in Hawaii, but you don't quite know where to start looking for those, feel free to reach out to us at Mental Health America of Hawaii. Someone is usually available to answer the phone Monday through Friday, about 9 a.m. to 4 p.m. We're always happy to point people in the right direction, to answer any questions that we can to the best of our ability, or to help point people towards these really awesome resources and programs and organizations that have been continuously offering services to those in need in our communities. So here's our contact information. Feel free to reach out if you have any questions. But with that, I hope you got a kind of a good snapshot of that landscape of what mental health looked like before the pandemic or before 2020, and kind of that temperature check of what we have been seeing thus far as research continues to be available. So I think with that, maybe we have a Q&A session, or I'll pass that virtual back to Nolan and he can tell us what to do.
Hey, Amanda, thank you so much. Ladies and gentlemen, round of applause for Amanda Martinez. You see all of the applause you're seeing on the screen, Amanda? That's for you. Someone even gave you a donut.
That's all I wanted was a donut.
Oh, now you're going to get a ton of donuts. Here it comes. Here you go. But Amanda, it's so great to be able to kind of see, not only hear what's going on, but be able to see the statistics that give us a clearer, landscape of what's going on in our community right now. And I was wondering, as you mentioned that, we're seeing an uprise in all of these statistics, and you said it's not just the pandemic, but there's all kinds of other things, social media, the political environment. Do you think, though, or do you see, based on these numbers, that there would be any reason to think that they will start to trend down at any point because of anything happening, whether it's things start to clear back up with the pandemic numbers going down, maybe the work being done to provide more resources? What is your take on what you foresee in the foreseeable future?
I think that's a great question to ask. It's hard to kind of predict that.
Right.
So no one can predict the future, right? But the hopeful little aspect of me wants to say that it's definitely a possibility, especially I think one of the more positive things to come out over the past year is that there has been more of a light being shown on mental health, right? More
Yeah.
people are having conversations about mental health, sending the message that it's okay to not be okay sometimes, you to reach out for help because getting help is effective. So I think the more we can continue on with those efforts and that kind of route of thinking, then hopefully we will be able to see those prevention efforts taking effect and being a buffer in mitigating, all of those risk factors or these increasing impacts of negative impacts on people's mental health that we have been kind of seeing come out. So yes, hopefully let's continue the good work and hopefully make a difference in those numbers.
Was there anything in those numbers that surprised you, either good or bad, when you're doing this work?
Nothing too surprising. I think a lot of our efforts here at Mental Health America of Hawaii are very much so focused on that prevention aspect. So part of that is trying to be prepared as best as we can and look more upstream. So, I think it was just safe to assume that there would be a negative impact on people's mental health, everyone's mental health, right?
Right.
Because everything that we knew before kind of went out the window. So we've been trying to find new routines and new schedules and establish new self-care practices and how do we connect with our friends and our loved ones in new creative ways. So I think that the data that has been coming out isn't too surprising from that lens. But I think what did surprise me a little bit were those reasons behind the increasing rates, that it wasn't just the pandemic, right? That we see all these other kind of larger societal factors that have an influence. So it's all just a bunch of things put together.
Yeah. Now, Amanda, we had a couple of questions in the chat come up. So I was wondering if I could ask this to you. This is from Randy Hack. Thank you, Randy, for your question. He's wondering if the Healthy People 2030 is out, and if so, does it have a suicide prevention goal as it did in the past?
Let's see. Hi, Randy. It's so good to see you here. Thank you for that question. I actually don't know off the top of my head if Healthy People 2030 is out, but I would assume that they would, or hope that they have a suicide prevention aspect to it and piece to it like they did in the past. I do know that Hawaii itself has goals and intentions for working towards suicide prevention, so that is even a piece within our own kind of efforts here in the state. But off the top of my head, I'm not sure if that Healthy People 2030 is available quite yet.
Well, our friend Mestiza said that Healthy People 2030 has been released, and I think they put the link to it in the chat. Thanks, Danielle. I think she put in the link there. And they said it's a federal document. So maybe, I guess last goal was around 100,000 per 100,000, it says here. They set in the rate per 100,000, Randy thinks. So I don't know if that helps you in any way with your answer. Okay, so if anyone else has any questions for Amanda, we'll keep her on just for another a little bit longer here, and you can throw it into the chat. Amanda, I think everyone is just really loving what you've prepared for us today. I mean, by all of the stars and donuts you've received, you got some rocket ships too. But I know you mentioned the different resources that people have access to for help. For those, here we have a question from Pedro. Hey, Pedro. He said, what are your recommendations for friends who are dealing with some of the issues you mentioned? He read my mind. I was just about to ask this. How can we be of support to others?
Okay, so there are a few different ways that we can do that. I think first and foremost is making sure that we are taking care of ourselves, that we are practicing self-care and checking in with our own mental health, because we cannot pour into others when we ourselves are empty. So if we're not taking that time to boost our own mental health and mental wellness, then it's going to be hard to show up and take care of other people. But when we are in that place to be able to do so, it's just being there, right? It's having empathy. It is being able to listen actively without judgment or any biases, whether we are aware of those or not, right? So not just kind of sitting there and letting someone talk at you, but listening with your ears, so listening to the things that people are saying or maybe what they're not saying, right? Reading in between the lines a little bit. It's listening with your eyes, so being on the lookout for changes in people's patterns or behaviors. Are they acting differently than they normally would? And that something that we're starting to notice? And it's also listening with your heart and with your stomach. I know it's not a very scientific thing for me to say, but if something that someone says or something that someone does just doesn't quite sit right with you, it gives you that bad feeling in your stomach. Don't just ignore that feeling. Don't just ignore that instinct. Follow up with it. Ask some more questions. Just let the other person know that you care and you're asking because you care. And you can literally say that, I care about you and I'm worried about you and I just want to make sure that everything is okay. Right? So that's how we would want to check in with someone that we are worried about, but we can also show up and help support people in really easy ways, like building people up a little bit, maybe sending a text message every once in a while to a friend and saying, hey, I was thinking about you today and I hope you have a good day today. Like, that's a super easy thing to do, and that's showing someone that you care, that's reaching out and connecting and making that effort. And it only takes a couple seconds to type out and to send, right? So when we talk about being there to help support other people, of course, we want to be able to do so emotionally when someone needs us. But it could also be really easy things, not huge grand gestures. Right? So lots of
I,
different ways to show up. Yeah.
Yeah, and those resources that you shared as well, just having those available to share with people that could use it would definitely be a big help. But I love what you said about just being there as someone who's listening and willing to understand and support that way versus trying to judge. Because I think when I was going through as I go through my journey with dealing with depression and anxiety, the one of the early problems I had was the shame and guilt that I felt at first. And I didn't want to share it with anybody because I was afraid that someone would judge me about it. So to hear you say, like, just be there for someone without judgment, you don't know how much that really rings true and how much that can help somebody feel comfortable being themselves and recognizing that they have support in that way. So I'm so glad that you shared that. And I hope those watching and listening who do have people in their lives that maybe they could be there for, understanding what you're saying. It can make such a big world of difference for someone just to know that they could be in a judge-free zone. And others here in the chat are agreeing too. Sandra said great advice, and have Joan saying this is perfect advice. Thank you so much. Ben Meyer, thank you. So everybody here, I think I speak on behalf of all of our attendees here. Thank you so much, Amanda, for not only coming here today and sharing your knowledge, but taking the time to gather all of this really valuable information. It's going to be very helpful to us all, and your words of inspiration has been just so valuable. So thank you so much, Amanda.
Thank you, Nolan. Thank you, everyone, for having me. Enjoy the rest of the event.